Shall we start? Okay. So we have very small 3 topics: alcohol metabolism, fatty liver, and obesity. What is this picture on the right, onto your right? It's a wine, right? When I say alcohol, does it mean ethanol or methanol? When I say alcohol, does it mean ethanol or methanol? How many of you say ethanol with the E? And the rest of you are saying methanol. So, when I'm talking about alcohol here today, it is ethanol, okay? Methanol is poisonous. When you hear about all these news about spurious drinking, people dying from fake alcohol, that is methanol. Anyway, so what is metabolism of alcohol? It just means how the alcohol breaks down in the liver, in the body, mainly in the liver, right? So, how many of you know the drinking age, the legal drinking age for people in India? What is it? 21, right? Do you drink? I don't think you're going to tell me anyway. But as anybody drinks, it starts to get absorbed starting from our mouth, okay? The mucous membrane goes to the stomach and intestine, gets absorbed there. Absorption rate, remember, increases with gastric emptying when the stomach is empty. Therefore, you would see the people who drink alcohol without eating anything or a little bit of chakhana will get drunk very quickly, right? Very important thing, the third point, it interferes with the absorption of vitamin. A very important whole vitamin B complexes, you will see B1, B3, B6, B9 and even vitamin A. This is the picture you should remember for your exam. Only 2 main enzymes are involved: alcohol dehydrogenase and aldehyde dehydrogenase. So ethanol in the liver gets converted into acetaldehyde, which is, by the way, very toxic for the body and for the liver. As soon as acetaldehyde is formed with the use of alcohol dehydrogenase, it has to be quickly converted into acetate. Okay, that is helped by aldehyde dehydrogenase. As you will see in this picture, NADH is being formed in both of these, right? Ethanol to acetaldehyde, acetaldehyde to acetate, both of them form NADH. So a lot of NADH is being formed, remember that. Later on it will be used. Then there is a small system called MEOS, or microsomal ethanol oxidizing system, which also helps in the oxidation of ethanol in the body, especially when someone has drunk a lot of alcohol. When the alcohol is a lot in the system, then this system also starts to work. This is present as it says, microsomal ethanol oxidizing system. So it happens in the microsomes within the hepatic cells. Okay, so they do the same enzymes are used over here as well. Whenever you see a patient with alcohol abuse, you will find all of the enzymes in the LFT. So liver function test, I don't think has been done. When you would do organ test, then organ function test will be taken, I think, class later on. So when we do liver function test, which includes all of these, AST, aspartate transaminase, ALT, alanine transaminase, gamma glutamyl transaminase, all of these are raised in people who drink alcohol. Not just that you're drinking today, it will not get raised. With chronic alcohol use, and when you drink a lot of alcohol, that's when it gets raised. For a specific marker is there for chronic alcoholics, that is called CBT, which is carbohydrate deficient transferrin. Under your level, just the name is enough. Okay. So what happens in chronic alcoholism? Everything gets affected. There is not a single system in the body that doesn't get affected with alcohol. In the liver, causes hepatitis. Why? Because acetaldehyde itself is very toxic to the liver parenchyma. Then we have cirrhosis, alcohol liver disease. We'll see fatty liver later on. Then neurologically, cognitive function impairs. So whenever, I don't know if you get out of this, how many of you go out of this place into the city in the weekends? So you do go, right? So on the way you would see a lot of people who are drunk, and you would see how they behave quite abnormally. They are always in a confused state. I think if you have any of your family members or parosi that is always drunk, they will be drinking half of the day, you will see the behavior is quite different. They are always confused. They do not make sense when they talk. They have memory impairment. Even the way they walk is, it's not correct. Why all of these things? Because, and even if you do a CT scan of those patients, you would see that the brain is atrophied, as it is mentioned here, brain atrophy, meaning the brain is shrunk, the brain shrinks. So as the brain shrinks, so does the function of the brain, right? It's like an old man's brain. So they cannot remember anything properly because of the effect of alcoholism. Heart is affected, cardiomyopathy is very common in them, high BP, and even renal dysfunction. Pancreatitis is a very common and painful condition. Okay, happens because of alcohol. When you will have your surgery posting, you will see a lot of people with pancreatitis because of alcohol abuse. Then GIT. This vitamin mineral deficiency happens. So in one of your seminars, I asked this question: why would alcohol lead to anemia? Why would alcohol abuse lead to anemia? So the answer is because alcohol causes malabsorption of these minerals and vitamins, especially vitamin B12, folate, right? B1, B6, and folic acid as well. Why does it happen? First of all, alcohol is addictive, right? So, and it has high calorific value. So the person who drinks alcohol always feels full. So they would rather have alcohol than have any other nutritious food along with it. First of all, they would not prefer the food at all. Second thing is that, and the most important thing, when you drink alcohol, over time, it damages the lining of the small intestine and the liver, the mucosal lining. Therefore, the absorption is very much reduced. Anything that they're eating nutritious doesn't get absorbed. All the minerals, the vitamins doesn't get absorbed. Therefore, when there is no vitamin and no minerals, that will lead obviously to anemia. Anemia, right? Endocrine and metabolic impact causes hypoglycemia, hyperlipidemia, and hormonal imbalance as well. So, tell me which one of the liver is normal, to your left or to your right, the picture. To the left or to the right? The left is a normal liver. On the right is the fatty liver. You would see fatty depositions on the parenchyma on the top of the liver surface, right? What is fatty liver? It is excess accumulation of TAG in liver. What is TAG? Triglycerides, or simply fats, right? So when these fats accumulate, what happens is, over time it leads to fibrosis. There is scar tissue formation in the liver parenchyma, which gets permanent and becomes cirrhosis. Remember, fibrosis has its own stages, but fibrosis in the early stage might be reversible, but once it reaches the stage of cirrhosis, it is not reversible anymore. The liver cannot function normally anymore, no matter what you do, right? Impairs liver function and finally liver failure and death. In this case, only liver transplantation is the choice. The body maintains a system where there is fat deposition and fat removal, right, in the liver. So when this balance is disrupted, then there is more accumulation of fats in the liver and less transfer of fat from the liver. We get fatty liver. So this is what normally happens, right? Free fatty acids from adipose tissue. Adipose tissue ka kaam hai free fatty acid banana. It goes to the liver, right? Our diet, food, glucose from the body, makes the triglyceride. That also goes in the liver. Liver se kya hota hai? It goes to the periphery. Iska kaam kaun karta hai ye? VLDL. You must have read in lipoprotein. The work of the VLDL is to take the fats from the liver to the peripheral tissue for energy purpose, right? This happens whenever this system gets disrupted. That's when we get fatty liver. अब ये जो tag pool हम देख रहे हैं has to undergo beta oxidation, right, for oxidation and use up of fat cells. But when it doesn't happen, that's when we get fatty liver. So there is excess of FFA, meaning free fatty acid, that comes from the liver, from the adipose tissue, gets into the liver, right? And then when there are several factors. So these are some of the factors. So dietary intake, lot of carbohydrates. There is lipogenesis in the liver, again fat in the liver. Then we have mitochondrial dysfunction. Where does beta oxidation occur? In the mitochondria, right? So whenever there is problem with mitochondria, mitochondria ठीक से काम करेगा नहीं, तो वो beta oxidation करेगा कैसे? So beta oxidation gets impaired. Again, there is accumulation of TAG. Then choline deficiency, serine deficiency, and other mineral deficiencies. These are very important for the formation of VLDL. So when there is deficiency of these nutrients, VLDL बनेगा नहीं, VLDL अपना काम करेगा नहीं. So it will not take the fats from the liver to the periphery. So there will be again accumulation of fat cells, fats in the liver, leading to fatty liver. When does it happen? Why there is so much secretion of FSA in the first place? Whenever there is prolonged starvation. So starvation, why do we have free fatty acids in starvation? Because there is no glucose, right? The body has to make energy. It starts gluconeogenesis, starts breaking down fats to release energy. Under uncontrolled diabetes mellitus, you have read it yesterday also, I think, in physiology, high fat diet, all of that. There are certain toxins also that leads to disruption of this whole function. Some of those toxins would be carbon tetrachloride, arsenic, and lead, and even infections like hepatitis B. So, what is the relation between alcohol and fatty liver? It is the most common, by the way, alcohol is the most common cause of fatty liver. Fatty liver is not diagnosed, under suspicion. It is always diagnosed, while we are diagnosing something else. Ultrasound में diagnose होता है, just when we are doing routine ultrasonography for those patients, we see that the liver is fatty. So, alcohol inhibits fatty acid oxidation, first of all, promotes lipogenesis and malnutrition, as we have seen before. What happens here is that alcohol gets converted to acetaldehyde, we have seen before in the diagram. So I told you that there is NADH release whenever acetaldehyde is formed and whenever acetate is formed. So there is excess accumulation of NADH because of excess alcohol in the body. So this NADH promotes conversion of oxaloacetate to malate. How? If you remember from your TCA cycle, you would know that this oxaloacetate to malate is a reversible reaction. Usually malate to oxaloacetate hota hai, but in this case, because there is so much NADH, it promotes the conversion of oxaloacetate to malate. So what happens here is that oxaloacetate keeps getting used up for conversion to malate. So very less oxaloacetate remains to be used up for TCA cycle. तो जब oxaloacetate रहेगा नहीं तो TCA cycle होगा नहीं. When oxaloacetate has to combine with acetyl-CoA to form citrate, right? Then acetyl-CoA remains alone. So what it does is, since TCA cycle is not happening, it goes for fatty acid synthesis, therefore leading to fatty acid accumulation. There's a lot of fats circulating in the system, goes into the liver again, fatty acid accumulation. That happens because of alcoholism. Now, finally, the small topic of obesity. Even though I have this picture of a person with sandwich in his stomach, but understand that obesity is not only because of high carbohydrate diet or fatty diet. Okay, there are many reasons why somebody might have obesity. So you as a doctor, when you grow up and become doctors, please understand, see it from a clinical point of view. Do not consider every patient that they are taking over, means they are having very carbohydrate rich diet, that's why they are fatty or that's why they are obese. There are many genetic factors in this. There are many metabolic factors to consider, right? So what is obesity? It's a condition in which there is excess fat in the body. How do we know, how do we diagnose somebody as obese? Their BMI. How many of you have heard of BMI? Okay, BMI is a very important topic for your exam. It can come, even fatty liver and alcohol metabolism can come as a short note for you. Please remember those small diagrams and pathways and enzymes involved, okay? So BMI is body mass index. The formula is weight in kg. divided by height, that has to be in meter, height square in meters. Okay, so this is the range of BMI. Normally is 18.5 to 24.9, overweight, and then obese, considered obese from 30 to 34.9, and above it is morbidly obese, right? This is classification. Underweight is less than 18.5, normal weight would be 18.5 to 24.9. Overweight would be from 25 to 29.9 obesity. Above that, we'll have 3 classes, class 1, 2 and 3. Class 1 would be from 30 to 34.9. Class 2 will be from 35 to 39.9, and class 3 will be 40 and above. There are certain regulators in the body that controls the appetite. I want to discuss a little bit about it. So the satiety center or the hunger center in our body is in hypothalamus, right? So these are certain regulators. We have leptin, we have ghrelin, we have neuropeptide Y. Leptin is very important. It is secreted by adipocytes. Okay, so it inhibits, its function is to inhibit neuropeptide Y secretion. So when the body is fed, when there is enough energy in the body, leptin gets activated, increases in number, goes to the hypothalamus, tells them that please stop making neuropeptide Y. Okay, it stops the appetite. Then comes neuropeptide Y. This is secreted from the hypothalamus. Okay, this stimulates the desire for carbohydrates. So when you want to eat carbohydrates, understand that this peptide is being used in your body. This inhibits insulin secretion. Same with ghrelin. This is also secreted by adipocytes, stimulates hunger. Whenever there is starvation, there is fasting condition, this will get activated and you will see plasma levels of ghrelin has increased. And then there are non-essential fatty acids. They are released from adipose tissue during fasting. It reduces glucose uptake and promotes lipid burning as a fuel source instead of glucose, and spares the carbs for neurons. So do you know what are the parts in the body that uses glucose, only glucose as their sole source of fuel? Which are the organs that use only glucose and not anything else for their energy source? Brain uses that, RBC uses that. They cannot use anything beyond glucose. Okay, so what these non-essential fatty acids do is that it leaves the energy that is derived from carbohydrates for brain and for RBCs, okay, to be used for them, and the rest of it they act as a source of fuel. If somebody is obese, what happens in the body? What are the biochemical changes? We will see that there is decrease in the sensitivity of the peripheral tissues to insulin. What it means is that insulin's role is for the uptake of glucose from the circulation, right? So this uptake will not happen. Sometimes even there is insulin resistance. There is insulin receptor insensitivity. So insulin is there in the body, receptor is there in the body, but the receptor is not sensitive to the presence of insulin. So insulin uthayega nahi, and then there will not be uptake of glucose in the body, right? Therefore, there is lots of insulin in the body. There is plasma insulin level rises in the body. There is leptin resistance, increased plasma leptin levels, and of course there is huge risk for the occurrence or the development of coronary artery disease, heart conditions, diabetes mellitus, hypertension, etc., and therefore obviously a lot of reduced lifespan, right? The treatment includes weight reduction, dietary restriction, regular physical exercise, and under medical. All of these has to be done under medical supervision. Why? Because you do not know the condition of the patient, somebody who is obese or somebody who is morbidly obese, how the condition of the bones are, what are the metabolic condition in the body. You cannot tell a person who's like 200 kg of weight to start doing jumping exercises, right? Their bones will break. Or a person who has heart condition, to tell them to start doing cardio exercises. You cannot be telling them that. So all of these has to be done under medical supervision. Each person has to have a personalized plan for weight reduction. And finally, bariatric surgery is the last option. They cut a portion of the stomach, and then that reduces the appetite also for that person, but that's only morbidly obese persons. So this is where the class ends, right? I hope that you will get a little bit idea about what I talked about today. And remember, these are important for your short notes.